Hi, my name is Stan.
My name is Connie.
My name is Judy.
My name is Alien, and I'm a caregiver to my mother.
And I care for my mother, Octavia.
And I'm a caregiver for my mother.
And I'm a caregiver to my husband, Art.
I'm a caregiver for my wife, Ann, who's 72 years old.
Basically, I've done everything for providing for both of them.
I take care of my mother on the weekends. I take her grocery shopping.
Not only household chores.
I provide her medical care, coordination, driving, errands.
Choosing meals, making meals, cleaning up.
I find that I take care of anything that he can't take care of.
Sometimes I find balancing time a real challenge.
The difficult part for me is taking me into consideration.
Balancing her needs with the needs of my family, the needs of my marriage, and my own needs.
Staying calm, nice, and positive.
The real challenge is, of course, the distance and the moment you get that last phone call.
What I love most about taking care of her is knowing that we're providing a secure and comfortable home for her.
It's the time we spend together.
Is the adventure of finding out new things all the time to trying to help him stay out of pain.
My name is Ed. I'm a spouse and I'm a caregiver.
My name is Colette. I'm a daughter and a caregiver.
I'm a caregiver, and I'm a daughter.
And I'm a wife and a caregiver.
I'm a daughter and a caregiver.
I'm a son, a nephew, and a caregiver.
Hi, my name is Deborah Day, and I help manage United Way Caregivers Coalition. While caring for a loved one has its special rewards, it's a very challenging job. It can be stressful, overwhelming, and sometimes lonely. Each caregiving situation is unique, but all caregivers share the need for information and support. And that's where the Caregivers Coalition comes in. We help caregivers receive the support they need to take care of their loved ones and to take care of themselves. Caregivers who lead healthy, productive lives will be better caregivers. The most important thing to remember is that as a caregiver, you're not alone.
We have so many wonderful topics, and tonight's I'm very interested in because I think it's one that we don't really deal with very much, and that is dentistry and teeth and what happens to people. Because of all the things that you think about when you're taking care of someone, I don't know to what degree people really give that due consideration. So I think this is a really important talk. And we are joined by Matt Kayne, who has been in practice for 30 years, having taken over his dad's practice. So it's actually been in existence for over 70. His invaluable, incredible, and amazing wife is Lori Kayne, who is a care manager, care consultant, and so they're a wonderful, involved couple in many areas. Matt is currently running for town council. He's been on the board of Ed in his town for over 9 years, so very civically active. And I bring to you Matt Kayne. Please welcome him.
Oh, can I say one thing? Hold your questions to the end, so we can get them all together and get them on video if it works out. Thanks.
So good evening, everyone. Thank you for that introduction, Ruth. I first would like to start off with a little bit about myself, my background. I went to dental school at the University of Pennsylvania. That's down in Philadelphia. I was very fortunate to have the education that I had. 2 years into the education, probably the best thing that's happened to me as an adult occurred, which is that my future wife and I were introduced on a blind date, and she's sitting over there, and we ended up 2 years later getting married, and we've been married, as was said, for 30 years. We have together 3 children. We live in Morris County. Our 3 children are grown. They're out of the house, and they're on to doing some great things. I always credit Lori for everything with respect to our children and the quality that they are. With respect to dentistry, I did take over my father and his partner's practice. It's been around for 70 years. And we are My partner and I do a lot of work on people of all ages, including many seniors, because our practice has, over the years, grown up. In today's lecture, what I'd like to do is talk about 3 general topic areas. I'd like to talk about just some background information about teeth and the mouth. Then we'll talk about how to care for senior patients, and then finally we'll get to dental care for patients with dementia. With respect to why dental care is so important for the elderly, there are a number of different reasons. Oral diseases are cumulative over the years, and they've definitely become, as the years continue, they become more complex over time. Oral manifestations, oral problems can have a very negative effect on quality of life. If you have loose teeth or teeth with cavities, that can make it very hard to chew. Facial disfiguration can occur in patients who have missing teeth or have other tooth problems. And ultimately, dental health has an impact on the whole body. Oral diseases can give rise to bacteria. If an individual has a lot of plaque, which is food buildup in their mouth, the bacteria can actually get into the blood and cause other systemic problems. We've learned over the years that the heart, diseases like bacterial endocarditis and other bloodborne related diseases can be caused from oral symptoms. The elderly typically do not seek dental care as much as younger individuals. Part of that, the number one answer why people used to stay away from dental care, and it might be embedded in the elderly's personality, is that dentistry was, back when the senior citizens were younger at a different time in the world, was an uncomfortable thing. So the number one reason why seniors still to this day, although I do believe when the younger generations now grow up, because they will have had comfortable dental care, they may not be as fearful, but the number one reason why seniors currently stay away from dentistry is fear. The second reason is a lack of knowledge and a lack of perceived need. Believing and the realization that tooth loss can occur as you get older is something that a lot of seniors don't learn until that happens to them. And seniors in the senior generation in the 70s, 80s, 90s were not raised with the thought in mind of preventive care being important, whereas nowadays the younger generations are taught how to take care of their teeth. Generally, they come in routinely, they take care of themselves, and they don't suffer the type of problems that the current level of seniors 70 on up have. The expectation is that the younger generations that are growing up now, because of understanding of preventive care and going in more routinely and not being fearful of the dentist, will likely, most everyone will have all of their teeth as they age, which is completely different from where we are right now with the seniors in the senior end currently. Other reasons is that there can be physical challenges in getting to the office, cost not being covered by Medicare, so fear and concerns about the actual cost. And then finally, of course, with seniors, there can always be a problem with manual dexterity in terms of taking care of themselves, working with floss and brushing, as well as diseases like arthritis, Parkinson's, having strokes can all make it difficult for seniors to have good care. There are handouts that were passed out, and the handouts just show a very brief, as we continue with background information, just show a very brief picture of dental anatomy. And if you look at on the bottom, just some key points. I'm not trying to make you all into dentists, but just trying to give you an understanding that on the bottom right, if you look at the tooth, on the outside, on the top, that layer, the outer layer, is, as you I'm sure know, is the enamel. And the whole key, and we'll talk about this later, with what us dentists do is try to protect decay from getting to the inner layer, which is labeled as pulp. Pulp is where the nerve of the tooth is. So decay can form on a tooth, bore in through the enamel via bacterial acids. If it is stopped before that, the tooth can be fixed. If it is not stopped before that, it can be fixed, but it needs more work, usually something called root canal work. On the left side, you can see that there are different sizes and shapes of teeth. And in particular, what is important to know is that the teeth way in the back are flatter, bigger, broader. Those are the molars. And the molars are there for chewing and grinding food. The teeth in the front, when you smile, those are the incisors. The incisors are there for cutting food. They're much thinner, so when you introduce food into your mouth, the first thing you do is cut the food and then move it towards the back where you grind it with the molars or the teeth on the sides behind the front teeth, which are called the premolars. So I just wanted to include that so you had some background information of the shapes of teeth. As well in the mouth, there's saliva, and saliva acts as a lubricant and cleans the mouth and teeth. Some seniors have a lack of saliva. Certain diseases can cause that, and certainly I know as one ages into their 90s and beyond, it's more and more common. There are some medications that are helpful to increase salivary flow, but those who have a lesser salivary flow tend to want to suck on candies, which need to be sugar-free or they'll cause a lot of decay, or do other things, drink a lot of water to try to increase the amount of lubrication in the mouth. One of the biggest problems with the individuals who are senior citizens is periodontal disease. Periodontal disease is where if you look at the picture of tooth anatomy, you can see that at one point on the left, midway through, there's a white area that shows the bone. That's the jawbone that holds the teeth in place. Typically, the jawbone levels are approximately at the 70% mark on a tooth, but over the years, and it used to be a misconception that over the years people just lose the jawbone and the teeth eventually get loose. We know now, and we have known for years, that the loss of that jawbone over the years is caused by food buildup via bacterial activity, and the whole concept that we teach our patients now is to keep the mouth as clean as possible by various modes necessary to keep food buildup off your teeth. But it is bacteria that eat that food, that throw off acids, that cause the bone levels to drop down. If you have loss, if an individual has loss of 70 to 80% of the bone, the teeth can become loose. At times they need to be removed because they don't have support. Anything beyond 70% usually means the tooth is not too long for this world. So that is, in the senior citizen generation on up, that is the number one reason for loss of teeth. And the second is extreme decay, which we don't see too much anymore in dentistry. But periodontal disease or bone loss is by far the number one reason for loss of teeth. Seniors are at a risk for oral problems for a number of reasons. Again, the cumulative effect of oral disease is over the course of a lifetime. With respect to the actual teeth, the gums cover the part of the teeth down by the base, and they also cover the jawbone. When the gums recede, that is called recession. When gums recede down, forced either sometimes by chronological age, but sometimes by heavy brushing or just wear and use over time, the jawbone levels reduce as well. That's what we talked about with periodontal disease. Any reduction in the bone levels can cause less support, destabilization, and eventually loss of teeth. There's also, when recession occurs, decay along the roots of the teeth can occur. If you look at your tooth anatomy, it shows the different layers of the tooth. Actually, this diagram is not exact in that the enamel covers to about the level where the gums are, but if the root of the tooth is exposed in a tooth that has recession, that layer of tooth, the root is made out of something called cementum, and that layer is much easier for bacterial acids to cause decay in it. So if someone has recession, it's much easier for decay to form on the roots of the teeth if they are not kept clean. Some individuals are just simply predisposed to cavities and tooth loss due to periodontal disease, but it usually is caused by poor hygiene, systemic disease, and medication issues. There are certain medical conditions that do complicate care. Major impact is caused by side effects from medications. Most individuals, as they age, end up taking different types of medications. There are a whole slew of hypertension drugs, for example. We talked about dry mouth, that can cause dry mouth. So if an individual has excessively dry mouth and is taking high blood pressure medications, then a thought might be to consider to speak to the cardiologist or the internist to see if the medication can be changed. Low amounts of saliva, reduction in saliva caused by medication has the same effect on the teeth, which is that food doesn't get washed away, teeth can tend to get more soiled, and they can be more prone to the problems we talked about, bacterial problems causing periodontal disease, loosening of teeth, or decay. Also, aspirin, blood thinners, can cause excessive bleeding in the mouth with the gums. And high cholesterol medications, Parkinson medications, can cause taste disorders in dry mouth as well. Antipsychotics cause dry mouth, you know that, and taste changes. And then bisphosphonates, they're this whole class of drugs for people who have osteoporosis. There's been a lot of recent research on this and debate back and forth, but the expectation is the drugs that are generally prescribed for osteoporosis, which many ladies have or take these drugs, can cause a weakening in the bone and make it so that extractions or placement of implants, one way of adding teeth if there are no teeth in an area, can be not something which is considered in this subset of patients. Taste changes typically does not occur without these medications, but for seniors, smell capacity and other oral changes for the loss of flavor perception can occur, and just general interest in food. We typically see in later age seniors that there is an increase in just not wanting to eat, and it's really because of those factors. Darkened teeth can be caused by changes in the dentin, sometimes tissue under the tooth enamel, and by just a lifetime of drinking any item like coffee, red wine, tea, that can cause staining on a white cloth. Changes in chewing and swallowing usually are not a problem, but when compounded with systemic diseases like stroke or Parkinson's disease and drug regimens like the antipsychotics can cause complications like choking and sometimes aspiration, sometimes dentures. If a patient is wearing dentures and you're a caretaker, you can find that they might not fit well because of a loss of weight. Over time, when you're wearing a denture, the gums underneath the denture can change, and the denture itself doesn't change, but the gums underneath can change with loss of weight or increase in weight. And either way, there are remedies for that. Sometimes you can use something like Fixodent or Polydent, sometimes denture adhesive, but there are also remedies that can be used in the dental office to make the dentures fit tighter. And of course, also changes in chewing and swallowing can occur just because of poor diet and lack of good nutrition. Older patients, senior patients, have an increased risk of oral cancer, and finally, there is a higher risk of inflammation because of the lower salivary flow. Now, that's a background of just different concepts that I wanted you to understand, but getting into more important and more pertinent concepts. First of all, how to care for senior patients. Preventing problems is done by different regimens of keeping things clean. As I said before, we want to just keep food buildup off of teeth. And if a patient does have teeth, then the first mode of taking care of them is to floss. We have a regimen that all of us dentists that have a good knowledge base recommend, which is to floss first, then brush, and then use a mouth rinse. Flossing is the string placed between the teeth, and generally speaking, when it's used, we like to suggest wrapping a loop around one finger and then your other index finger, and then pull it taut as you go through the contacts, the areas between the teeth. And then wrap a C gently around each tooth and pull the floss up. When that's done, it gets the entire area, it removes the food from between the teeth on both teeth that you're working with, and then just go to the next tooth, keep on going as you move through. It can take all of 2 minutes to floss. but it's probably the most important thing that can be done. After removing the food from between the teeth, then brushing is the second step with a fluoride toothpaste. There's so many different types now when you go to the store. Colgate and Crest are the two biggest, and their Total Care brands are generally the best. Brushing is done after flossing so that you can remove the food buildup that the floss removes, and then with brushing and with fluoride toothpaste, you can use the toothbrush to remove food from the flat surface of the teeth, being the outside, the top, and the inside, and you want to get to each surface. When you're done brushing, you're still not done. The use of a mouth rinse is excellent. Using that for 30 seconds, any of the big name brands are fine. That will remove, finally, all the particles in your mouth, and that's a very, just a typical way that we recommend to our patients to do it, and if you do so, you'll find a way to keep the food off your teeth. The other thing is that food that you're trying to remove is just soft food. When you've eaten now, as you have, the food that accumulates on your teeth is something called plaque. Plaque is soft food buildup that sits on your teeth less than 24 hours. Once plaque, if it's not removed, is as it is left in the mouth, it will calcify or harden. And if it does, it will attach to the teeth and become impossible for you to remove. The reason that we suggest for patients 3, 4, or 6 month maintenance visits is depending upon their food buildup and the damage that it might cause in their mouth. But in essence, when you go in to see the dentist/hygienist for a maintenance visit, that is to remove the calculus, the hardened buildup that you are not able to remove with floss, with brushing, and will not come off with mouth rinsing. So again, the whole concept is you're trying to remove the soft buildup. That soft buildup, you don't have to brush hard. I know that when many of you were younger, you were told to use a hard brush and scrub, scrub, scrub. That's really not the case. We know better now. You really want to use a very light motion. You could use, for example, a Q-tip or a piece of foam on a stick, and it would do the same thing. But you have to have, as well as doing the regimen we talked about, you also want to see your dentist regularly and have your teeth cleaned for anything that you're not able to get. How to deal with certain specific problems. First of all, dry mouth. When anyone who does have dry mouth, we recommend drinking or sipping water regularly throughout the day. We recommend for our patients to bring water with them wherever they go. And I know that this can promote other issues like having to relieve yourself, but it is important to drink water often to keep the salivary flow going. We also recommend for those that have dry mouth, do not use sugary items. Typically with a low flow, the sugar doesn't wash away, so it is best not to have sugar in your mouth to begin with. I've seen so many mouths have severe problems when patients had minimal salivary flow and they sucked on candies to relieve themselves. There are on the market and on the internet, there are certain types of sugar-free lozenges that do help with dry mouth. I don't know their names offhand, but they can be researched that do help with dry mouth. We definitely recommend to limit alcoholic beverages because alcohol itself will dry the mouth, and to stay away from sugary drinks and caffeine. We also recommend the use of a humidifier for people with dry mouth, mouthwashes or sprays. There is an item which is well known and out in the market and in the stores too called Biotene, B-I-O-T-E-N-E. And it's probably the #1 product, but dentistry, having friends who are in the research area of dentistry, there are other things being researched that may be coming out fairly soon. And the final thing that we do recommend for patients with dry mouth is that there are fluoride varnishes that can be placed on the teeth. It's a little coating for the teeth, which does help to protect the teeth. With dry mouth, there's a very high risk of a number of different issues, including decay along the roots of the teeth. So cavity varnishes sometimes protect the teeth and help in that way. For patients who have difficulty brushing teeth due to physical issues like stroke, arthritis, rheumatoid arthritis, multiple sclerosis, etc., there are electric devices that have become pretty prevalent nowadays and are sold either in stores or dental offices. I caution with respect to them. There's some very good devices out there, and we recommend the ones with the circular heads. But I caution that if the brush is not used the right way, it will be of absolutely no use. The way that we recommend using it, it's a little rotary head, is to put it on each surface and let it do the work and keep on moving it from tooth to tooth to tooth, surface to surface. These rotary devices will do a great job. But if you just keep on moving it like this, side to side, it will have absolutely no function. So it's important to use it the right way. With respect to, for those patients who have dentures, again, a sea change of different material in terms of how to work with them that in the old days used to be very different. In the old days, patients were told to wear their dentures all night long. We now know that that's something which is not a good idea. Dentures should be, in most all cases, removed during the night to give the gums a chance to rest. We also do recommend cleaning and massaging the gums under the denture to increase circulation. You can use the back of a toothbrush or even use fingers just to get the blood flow circulating. And finally, dentures need to be cleaned extremely well. There are different items in stores, but basically, if you use a toothbrush with limited amount of toothpaste with warm water, you can do the same thing. Now, getting to the final topic is dental care for patients with dementia. It is important to understand that the most important concept is that when dementia is seen, when early changes are seen, it's very important to prepare for the future. The overriding thought process is that as patients, as they deteriorate, as their mind changes, they become less able to and less prone to be able to be helped by dentistry. So in early stages, it's important to get as much work done as possible. Studies have shown that poor oral health is greater in individuals with cognitive impairment. Brushing teeth is a complicated process with many steps and usually done even for those patients with memory. With cognitive impairment, some, if not all, steps may be forgotten and the patient may not remember what's important. We find all the time that patients who have even early to mid dementia will just brush lightly and then put their brush down, not really thinking and realizing what it is that they have to do. And it's important for someone to watch all the time so that the right job that we highlighted before can be done. In the early stages, as I said, it's important to focus on restoring the teeth. Teeth can be checked with x-rays with different modes, any areas of decay, any teeth that need to be fixed with larger work, crowns or covering, or even dentures should be done then, in great part because it's very hard later, as I said, to work on those patients. But also, patients who are going to have any kind of removable appliance need to get used to it very quickly in the early stages of dementia. If they have that introduced mid or late, they're not going to be able to get used to it, and the odds are the denture is going to be lost. As much work as possible should be done, as I said, and patients should carry on with their own care for as long as they possibly can. But as I said, they should be monitored, they should be watched to make sure that they're doing the right job. As we move to the middle stage of dementia, focus has to be on just protecting and saving what you have. So we talk about prevention of further disease with elimination of pain in particular. If there is an area where the patient points to or the individual points to, then by all means that should be fixed. But at this point, it's already too late to engage in any other types of work. If there were areas of decay that were not taken care of in early dementia, very often they're just left until they become a problem and then the tooth is removed. But until such time, again, if they're caught early, you can restore anything, fix anything, and then move to the other stages. Simple instructions need to be given to these patients. They can't handle a lengthy seminar like this, but if you say something like brush your teeth or hold your toothbrush or put toothpaste on, the odds are it's not going to register, so it's just got to be a quick word, brush, do this, do that. Use watch me techniques. So you take the toothbrush if you're a caretaker and try to show them what to do. Flossing, I think, at this stage already becomes a little bit difficult, but try to have them watch you do what you're supposed to do. And even mouth rinse that we talked about before, it's a little bit hard for them to start using it then. If they don't have the technique beforehand and have committed memory, they'll probably try to drink the mouthwash, so it's not a good idea to get involved with that. It's really just a matter of protecting what you have and trying to keep pain away. If the individual is agitated, just leave them be. Return later at some point in time, don't make an issue about it. Fluoride toothpaste sometimes is a problem too. You may want to use a tiny amount or none at all, because if you put toothpaste, even at this stage, on a toothbrush, the inclination very often is to isolate it and then swallow it, because it tastes, the perception is it might taste good. It's not a good idea to have them go into the bathroom. You can do so if you're watching, but if not, you can have them brush while sitting at a kitchen table. Again, it's just important to watch all the time. Sometimes there are toothbrushes that have larger handles, and those might be easier for dexterity for these patients. There is a technique for putting a tennis ball on the end of a toothbrush. I don't know if any of you have seen that. Sometimes that is helpful, but it does also make it a little bit hard to brush, but it's something that can be tried if you think that that would work. For flossing, there are items called floss holders. I don't know if I brought any today, but actually in the bags there is a floss holder. And what they are is it looks like just a little bit of a V with a holder, and you can put floss on it, and that floss holder then can, instead of using your fingers, you can use the floss holder to get between the teeth and wrap that little C around the teeth so that hopefully some of the plaque can be removed. Finally, look for signs of dental pain. If the patient is refusing to eat, there may be a link to some kind of tooth pain. Sometimes they will point to an area. It's not a bad idea to try to get them to a dentist to have it looked at. If the patient is refusing to wear dentures, it's very possible that the dentures may have loosened over time and that they might need some kind of adjusting in a dental office. So be aware of that when they chew down, if they're wearing dentures and they express some kind of discomfort, think about having them see a dentist. Sometimes you can get away with putting some adhesive like Fixodent or Polygrip on the denture in the area you think it might be if you really need to avoid getting them to a dental office. You might see as well in this set of patients, if you're thinking about looking and you're wondering why a patient is not eating, increased restlessness, moaning, or shouting. You might see disturbed sleep over time. You might see refusal to take part in daily activities, and you might even see aggressive behavior. If patients have a history of getting their teeth cleaned in a dental office, it's possible that they might be willing to head over to the same office that they've been going to and get their teeth cleaned, typically by the same individual. But if you take them out of their routine, as you know, it's going to be very hard for them. It's typically advisable, if they're going to be going to a dentist, to arrange visits at the best time of day for them, whether that be late morning, early afternoon times when you don't have to deal with traffic. Arrange with the staff, call the staff in advance to let them know what's going on with the patient in terms of this level of dementia or Alzheimer's, so that the staff which should be trained in this so that they can understand that you want to kind of get in, get everything taken care of, and then get out. Treatment should be done in a very quiet area with as little disturbance as possible. And remember that denture loss is a problem for everyone, that plagues everyone. Patients in this stage may forget to wear their dentures. They may forget, it may take them off at night and leave them in their bed. Eventually, most dementia patients reach a point where they will not tolerate dentures in their mouth. And ultimately know that dentures can have identification tags put on them by the dentist who makes them. In the later stages of dementia, treatment focuses on whatever you can get done, which is usually not all that much. These patients typically are not willing to have much done in their mouth. We have actually in my practice a few patients that are mid to late that allow us to treat them, but that is because they've been ritualized into coming into our practice for so many years. Typically at this stage, you can't introduce anything new, but look for the signs of discomfort that we talked about with tooth discomfort or denture discomfort. Isolate them, and if they are having extreme discomfort, get them to an office that can help them. And that's it for my organized lecture this evening.